hand sanitizer. I'll introduce myself. Hello, my name is Paulina.
Hi.
I'll be your student nurse today. I'll be explaining how to self-inject your medication.
Okay.
Can I get your name and date of birth for verification?
Sure. Sarah Arthur, and my date of birth is January 30th, 1956.
Okay, sounds good. Okay, Sarah, is this a good time for me to teach you your medication, or do you want me to come back?
No, this is fine. I'm not doing anything in particular.
Okay, that sounds good. So the medication that we're going to be administering today, it's called Heparin.
Okay.
The trade name for it is called Oraped. You're going to be getting 5,000 units for 1 ml. So at home, you're going to be injecting 1 ml or 100 units.
Okay.
And I have a little sheet for you right here that explains where are the possible injection sites. So I understand that you have trouble with your hands and that it's hard for you to inject. So I know your family member is coming over later. So I'm going to explain it to them as well. And I also have a couple sheets for you so you remember, because I know this is a lot of information for you. So possible sites that you can use is your thighs, your abdomen, or if somebody's going to be doing the injection for you, you could use the back of your arm.
Okay.
This is a subcutaneous injection, so it's going to be going directly into your fat, or as we call it, adipose tissue. You will be injecting it at a 45-degree angle. So a 90-degree angle is kind of just straight down at your skin, and you're going to be kind of doing just half of it like this.
Okay.
So that's just something for you to have here. And just so you know, you're going to be using a 1 ml syringe with, or it's equal to 100 units.
Okay.
And then just to get you started, the way you would first do it is you would apply some gloves. And it's important with this medication to avoid alcohol. And you do want to dispose of your sharps, which I have another sheet for you here of where you can dispose of your sharps.
Okay.
Some people,
go home, right?
yes.
Okay.
Some people use an empty Tide bottle from their detergent to dispose of it. I mean, it all depends. So the first thing you want to do is roll your vial, like so. Then you're going to take an alcohol swab, and you are going to just clean it, because you're going to insert your needle there. Okay, you're going to let it dry for a little bit. Then you are going to uncap your needle. And the most important thing you want to do is you want to take out the air of the amount of medication that you want to take. And the reason we're doing that is because we're going to inject this air into the vial, because if we just keep taking out the medication without inserting the air, it's going to cause negative pressure. So it's important that we do that, and then we just flip it over, and don't worry, the needle won't fall. And then you just kind of slowly take out the medication. There's no need to rush, up to the 100 unit mark, or 1 ml. Like so.
1 ml.
Yep. Very good. And then you're going to flip it over like this. And you're just going to look and make sure there's no air bubbles. If you see any, you just kind of flick them like so.
Okay.
Then you're going to recap your needle using a one-hand method like that. Because the next important thing is you want to disinfect the skin that you're going to be using. So like again, that was the abdomen or your thigh. So you're going to do it like that. Then you're going to uncap. You want to squeeze your skin before, and remember we're doing a not a 90-degree angle, but a 45-degree angle. So you're just kind of insert it like a dart, like that, and then you're going to insert the medication. There's no need to rush. So common side effects you may have is some bruising, which is common, but you don't want the bruising to get more than a quarter. If it gets bigger than a quarter, you have to report that. So after you inject all of the medication, just wait 1 second, let go of the syringe, and then let go of your skin. And then you want to recap it using the one-hand method. And then you can put a little cotton ball on this, like that. And then you're all good.
Will it bleed a lot?
No, you shouldn't have any bleeding at all.
Okay.
So do you think you understood that?
Yeah.
Do you think you can demonstrate that for me?
Sure, I'll try.
Okay, here are some cotton swabs for you, and then I also have a pair of gloves for you.
Okay, do I need to wash my hands with water or hand sanitizer?
Hand washing is very important, so it's important that you do that, and you should
Okay.
tell your family members that as well.
Okay, I'm gonna quick wash my hands.
Okay. And then I have another paper here for you, just explaining everything I just did, because I know it's a lot of information.
Okay, so this is when I go home in case I forget.
Yes.
I understand what you're saying now, though, but this is just a guide for me.
Right.
Okay, I washed my hands.
Okay.
I'm gonna put my gloves on. Okay. And then, so I take the alcohol swab first.
Mm-hmm.
I clean the top of the vial.
Right.
Okay. All right. While that's
Good.
going on,
Uncap your needle.
tap my needle.
Take as much air as you're going to actually use for the medicines, because you want the air to go in there.
Okay, so that's 100 units.
Units, that's right, correct.
Okay, that looks like a lot, but I guess it's not that much.
Nope.
All right there. And then we stick this in here.
Right, and don't forget that you're going to be doing this 3 times a day. So the best way for you to remember that is just associate it kind of with your meals.
Okay.
That way you remember.
Each meal time,
Yes, and each mealtime you're going to be doing 100 units each.
100 units each.
That's
Okay.
right.
All
If you
right.
let go of the needle, it won't fall, don't worry.
Okay,
And then you
won't
can just,
fall?
yep.
All right.
And then
Oh,
you can
other
just-
way. There we go.
There you go. Very good.
100, no, or 100 units.
Right. I know that you have trouble with your hands, so you could just ask a family member. I will review this again. And then I also have another calendar here for you for when you should come up for your INR checks. It's very
Okay.
important.
It's important.
Yes.
Okay. And then next we can cap it, right?
Mm-hmm.
Use one handed so I don't stick myself.
Right.
Okay.
Right. Once it's in, you can use your other hand to kind of just put it in. That's right.
Okay.
Yeah.
There we go. Perfect. Then we clean off our skin. So this would be
Very
like
good.
here. I would pinch it in my abdomen.
Mhm.
There's other sides, but that's the easiest one.
Right. Right.
Okay. Clean that off. That's all done. I uncap this.
Right.
I pinch.
Pinch, 45-degree angle, dart, and push.
Okay. This in.
There we go.
Hold it a second. That's not too bad.
Yep.
Then I inject.
Perfect.
I can take my time.
Yep, you want to hold it a second and then let go of the needle, take it out, and then take out, unsqueeze your skin. Perfect. And then you want to cap.
Cap again.
Uh-huh. And you can use your other hand for help.
No,
Perfect. Very good.
Oh, thank you.
Well, I'm happy
That's
to
not
hear.
too bad.
Yeah, not bad at all. Well, I hope you have a great day, Mrs. Arthur. Hello, I'm Paulina. I'm a student nurse. I'll be teaching you about your new medications. Can I get your name and date of birth for verification?
Sure, I'm Mrs. Arthur. January 30th, 1956.
Okay, very good, Mrs. Arthurs. Okay. Do you have some time to learn about your new medications right now, or is this a good time for you?
Yes, that's fine. I was just watching TV, but that's fine.
Okay. Well, I'm just going to talk to you about your nursing diagnosis first.
Okay.
So our priority with this medication, which is called prednisone, or as you may know it, Oraped, is that you may have a risk of infection. So one of the things that we want to diminish with this is you want to avoid being in large crowds. That's some short-term goals. Avoid large crowds, that way we minimize infection. You want to really do hand washing as much as possible, so that way you don't have any bad bacteria. And you also want to eat like a high calorie and high protein diet. That'll really help your immune system. I also would like to tell you that I know that you have trouble remembering your medications and you're bad with opening pills, so I would suggest for you to get like a pill organizer, like a Sunday through Monday kind of thing. That way it's easier for you to open your medication like this rather than opening the bottle like that.
Yeah.
So, yeah. So like I said, this is prednisone. Prednisone, what it does, it basically suppresses your immune system. And the outcome for this is for your inflammation to go down in your hands. That's very important for us.
Okay.
So I have here for you a little chart with the dates with the days and what dosage you're going to be taking. Only because this medication is a little different. You're going to be tapered off of it because we don't want you to go through withdrawal. So that's very important, so that way you don't forget. And it's very important that you take this medication with food. So associate this with like a lunchtime. So for example, you may want to take this right before or right after lunch. You want to take it with food, and that way you could just cross off every time you take it. And you'll be done after about 2.5 weeks on the 23rd with this medication.
Okay.
So some side effects that you want to report right away if you have any is if you have abdominal pain, bruising, bleeding, or if you have blood in your poop, because this is a contraindication. And some side effects that you may just have and you should just be aware of, and there's not much you can do about it, is high blood pressure, high blood sugar, edema, and mood swings. So just be aware of those. Unfortunately, that's just temporary with this medication. There's no real handling instructions or precautions with this. You just want to take it once every day by mouth and just swallow it. And then I have another calendar here for you because I know you're on other medications as well. It's important for you to get your INR checked, so you're already scheduled for the 9th, and your last day for this medication, Prednisone, is on the 23rd. So I understand that you're still on the Coumadin. Are you on for blood thinners for that one?
Yes.
Okay, and are you taking aspirin currently?
I am for the pain.
Okay, for the pain. And then your methotrexate? Okay, for your inflammation, correct?
Yes.
Okay. And then your folic acid?
For my anemia.
Okay, yes, because unfortunately that's one of the side effects of methotrexate. And then your vitamin is just for your deficiencies.
Right.
So you're still good for that, okay. Okay, sounds good. Well, do you have any other questions or concerns?
No, these are very helpful for me. Thank you very much.
Okay, have a good day, Mrs. Arthurs.
Thank you. You too.